Hi, my name is Gail Geller. I'm a professor in the School of Medicine and the Berman Institute of Bioethics, and I'm here with my colleague.
I am Debra Mathews. I'm an associate professor at the Berman Institute of Bioethics and a human geneticist by training.
So today we want to talk about the possible role of people's genes in influencing their body's response to the coronavirus and how they're treated if they get sick. We'll present a few background slides first, and then we'll talk together about some of the ethical issues. We've been exploring the connection between genomics and infectious diseases and their ethical implications for a long time, with support from a large grant from the National Institutes of Health called Bridging Infectious Diseases, Genomics, and Society, or BRIDGES. Now we have the opportunity to consider the ethical issues of genomics in the context of COVID-19. So a little bit of background. First, some terminology. COVID-19 is the disease caused by the novel coronavirus. The coronavirus is actually called SARS-CoV-2. The novel coronavirus is highly contagious. It's transmitted through everyday contact with affected individuals. It lives in droplets that come from people's noses and mouths through talking, sneezing, and coughing. With COVID-19, there is wide variability among individuals in terms of who gets sick and how sick they get. So what do genes have to do with it? Well, people's genes are likely to influence several factors, including how infectious they are. Sometimes we call highly infectious people super spreaders. Genes are also likely to influence how susceptible people are to the virus, what symptoms they get, how serious or severe their symptoms are, how they respond to treatment, and how they might respond to a vaccine. So what does all this mean? How could genetic information be used? A person's genes may be used to guide medical decisions. It can help doctors select the most effective treatment for a given person. It can also help hospitals figure out the best use of scarce resources. For example, if we identify an effective drug for treating COVID-19, but there isn't a large enough supply of that drug to treat everyone, would we treat people who are sickest first? Or if we don't have enough protective equipment for healthcare workers, would we distribute the protective equipment we do have in a way that gives first priority to healthcare workers whose genes make them more susceptible to getting COVID-19 or getting a worse case of it? Another way genetic information can be used is to inform public health policy decisions, such as when to return to work or school. Perhaps people who are less likely to get COVID-19 or to get very sick from it can return to work and school first. When deciding how to distribute vaccines, perhaps genetic information can help determine who should get the vaccines first. We've known about the relationship between genes and other infectious diseases like influenza or flu for a while. There's evidence that people's genes play a role in susceptibility to flu, the severity of symptoms, the likelihood of dying from flu, and the response to flu vaccine. COVID-19 is similar to the flu in some respects, and we expect that scientific research will show that people's genes may play a similar role with COVID-19 as well.
So, is there research going on related to genomics and COVID-19, you might ask? The simple answer is yes. A group of researchers from many different countries have formed a consortium to study the role of human or host genetics in COVID-19 infection. It's called the COVID-19 Host Genetics Initiative, and it involves over 24 sites in Europe, the UK, Asia, and North America. Their goal is to share and analyze data that would, among other things, provide information about which drug might be best for a particular person, or to identify individuals at unusually high or low risk of developing COVID-19. Private companies like 23andMe and Ancestry.com are running similar research projects focused on the severity of infection. And it's important to keep in mind that the data available to these scientists, whether they work for private companies or within the academic research community, are largely from people of European descent. This usually means white people. So this research will not help us learn as much about other populations, like those of Asian or African descent. This is very unfortunate and problematic, since COVID-19 is more common and often more severe in people of color. A concrete example of the relationship between genes and COVID-19 has recently emerged from some of this preliminary research. Specifically, it has to do with people's blood type, which is controlled by the ABO gene. Several studies have suggested that people with type O blood might be less likely to develop a severe form of COVID-19, whereas people with type A blood might be more likely to develop a severe form of COVID-19. But more research is needed to confirm these early findings. So, with that background, Gail and I are now going to have a brief conversation with the help of our colleague Emmy about some of the ethical issues and policy decisions that we will need to grapple with.
So you mentioned that in an ideal world, genomic information related to COVID-19 could be used for good reasons. That is to improve treatment as well as healthcare and public health policy. Are there any reasons we should be concerned about the collection and use of genetic information?
Yeah, so earlier we said that most of the genetic data that we have are from people of European descent. And that lack of diversity really makes it difficult to interpret genetic findings for non-European populations. Also, we don't have the data we need to figure out how much of the variation in disease severity is due to genetics and how much of it is due to other factors like underlying health conditions, access to healthcare, and other existing inequities.
In fact, there is reason to be concerned that genomic information used to develop treatments or vaccines could actually exacerbate inequities. If some groups of people are left out of the research that's conducted, then the benefits that are identified through research won't apply to them.
So we've been talking about the genomics research that companies are doing. Are they also offering genetic testing?
Well, some of the direct-to-consumer companies are offering individuals what they call coronavirus health reports, but these are not necessarily based on reliable science. The concern here is that the results may be misleading. So people whose health reports suggest a decreased risk of COVID-19 may feel a false sense of security. And those whose health reports suggest an increased risk of COVID-19 may develop greater anxiety, but neither result may be accurate.
So in addition to the ethical concerns about the actual research that's being done or tests being offered, another concern has to do with whether these large genomic databases have adequate privacy protections. If the data are easily shared with pharmaceutical companies or governmental institutions or other large agencies, individuals may be identified through their DNA, and the data can be misused in various ways. For example, government agencies may impose stricter quarantine or travel restrictions for individuals whose genetic makeup suggests that they're at greater risk of contracting COVID-19 or having serious illness from it.
And another ethical concern is that individuals who are at greater risk of contracting COVID-19 may experience social stigma, where other people don't want to be around them. And genomics might also reveal that certain people are more likely to transmit COVID-19 to others or be more contagious. There's a real worry that these super spreaders, as we call them, would be avoided, especially since we're now seeing that even people who have recovered from COVID-19 are being shunned by their communities.
So we need to keep these ethical concerns in mind if and when genomic information is used to guide healthcare policy or public health policy decisions. So for example, in the context of healthcare decisions, is it ethically acceptable to withhold scarce resources from patients with higher genetic risk of mortality or lower risk of mortality? Is it ethically acceptable to deny hospital admission to patients with higher or lower genetic risk of mortality? What about using genetic information to make decisions about which patients are admitted to the ICU or put on a ventilator? And what about prioritizing access to scarce experimental treatments for those who are genetically at risk of serious disease?
And there are also concerns in the context of public health policy decisions. So is it ethically acceptable for quarantine measures or policies to be informed by genomics? Like those who are at lower risk of contracting disease do not have to stay at home. Or for vaccine, once it's available, distribution to be prioritized for those most likely to develop severe disease or least likely to show symptoms and so spread it without being aware. We often also have to think about whether it's appropriate to use these data to make decisions about returning to work or to school, or for travel and immigration restrictions to be informed by genomics. So for example, super spreaders facing increased restrictions. And these are just the sorts of questions that the Bridges research team are working on at the Berman Institute.